And Dr. Kennedy and Dr. Somari are here to talk a lot about what are the effects of the entire COVID crisis on medical education, and specifically some of the things some of our students who have already now graduated, fourth-year students who are doing out in the state of Kansas. And that includes Rebecca Ferguson, MD, and Anastasia, I'm going to mess this up. So I'm just going to say Koplova, MD, who are two of our 50 volunteers. I'm going to ask them to introduce themselves here momentarily, especially that last name, Anastasia, and tell us a little bit about what you guys are doing out in the state of Kansas. But before we go there, I want to first turn to Doc Hawk. Okay, Hawkeye, what we got today?
So our numbers have continued to go down in the hospital, luckily. We are currently at 15 compared to a week or so ago when we had 31. 8 of those patients are in the ICU. We can only pray and hope that those numbers continue to go down. We stay, we calling our equilibrium probably about 20 to 30 patients. If we can keep under that, that would be great. We have seen a good trend so far of hospitalized patients in the city. I had a little bit of concern this weekend.
You said you had a little anxiety when you were out. I had my anxiety as well. You tell.
Health guidance as far as physically distancing, wearing the mask, doing adequate and frequent hand hygiene, and not touching their face, because we really want to keep everybody healthy. If we are starting to kick off this economy and restart it, we want to be able to continue that and continue our first response.
Than that, because we know that it really does make a difference. So, Dr. Somari, welcome to our program. It's a delight to have you on. Tell us a little bit about the effects that are going on from COVID-19 in medical education.
Thanks, Steve. As you know, the KU Medical Center is made up of the School of Medicine, School of Health Professions, and the School of Nursing, and resides on 3 campuses here in Kansas City and in Salina and Wichita. When this all got started, our really thoughts were 3 dimensions. One was safety of our students, faculty, and staff. The second was continuity of our essential missions of research, education, and outreach. And the third was how could we be the best possible partners with our health provider colleagues across the state of Kansas, notably the health system. As everyone knows, our faculty are the faculty of the University of Kansas Health System, and that's been critically important on the front lines. We also have faculty who run county health commissions, both in Wyandotte County, Johnson County, and in Sedgwick County. And those folks often toil in anonymity, and now they're some of the most important people in our state. We're very proud of them. And then finally, we've had a large number of student volunteers from all the schools, and I know we have some online today with Dr. Kennedy regarding this unique program that Dr. Kennedy has put together in the state of Kansas. But we depopulated the campus. We've been able to continue. We had graduation on Sunday, or commemoration of graduation, in which all of our intended graduates graduated. We had some virtual hooding and recognition ceremonies this weekend. And it is bittersweet to have to do it virtually, but it was important to get these milestones taken place, and we did a very, very nice job with that. And then this week, we are starting very slowly in alignment with the state and Wyandotte County guidelines and Saline and Sedgwick County guidelines to begin to repopulate our campus, and it will come in a couple of ways. Notably, our basic science and clinical researchers are going to be creeping back on campus to continue their essential research missions. We're going to continue some face-to-face student activities, all the while reflecting the state and county guidelines for distancing and hygiene, and masking. So we're very excited about that happening starting today. And I know we've got Mike on board. Mike Kennedy took on a task at a time, quite frankly, that there were some calls nationally to take every medical student and to conscript them into a public service domain. And while that might have been considered potentially important but relatively harsh at one time, Mike took another approach, and we're very proud of what Mike and the students online today have done for the state of Kansas.
Thank you, Dr. Somari. And it is a great story, Mike. Talk to us a little bit about some of the things that happened, and then we're going to turn to our students after that to hear about their experience.
Yeah, definitely. Well, it was a huge task, but we put together a team, and man, that team met every day, and we wrote a program to do an early graduation program and take advantage of a law on the Kansas books for a special permit in the Board of Healing Arts for graduates of the medical school to work essentially as a clinician. And
Because
so
they finished all their 4 years. This isn't
Yeah.
like they're done. There's like
They're
they
done.
would have started residency, but instead they started with you in this program.
Exactly right. And I think that's what's different than a lot of the other programs, which truncated medical educations and put people into the workforce. And we definitely did not want to do that. So as we put this together, it just clicked into place. The timing was perfect. There had been no requests for volunteers, and then it seemed like as soon as we had the volunteer workforce ready, then here came the requests. And so we put people in some of the busiest counties, Ford County, which still has the top number of cases in the state. So Dodge City is pretty
yeah.
busy. And then Seward County and Crawford County. It's interesting that Finney County, where Garden City is, and Lyon County, where Emporia is, apparently didn't feel the need for volunteer use. And I don't know if they recruited from other hospitals in their network.
Right.
But so we have Anastasia and Becca, who
No. This is Dr. Anastasia.
Oh, yeah.
Come on
That's
now.
right.
Come
That's
on.
right.
Come on.
With
Actually,
Dr. Ferguson.
Dr. Ferguson. Okay, and Anastasia, introduce yourself, but say your last name first so that I can quit stumbling over it.
Oh, it's okay. I'm nervous enough that I really did not notice, and you did a great job. And it's Anastasia Koptilova.
Koptilova, that's what I was going to say.
Oh, yeah, that's it.
Don't be nervous at it, Dr. Koptilova. Okay, I can't say it now. And Dr. Ferguson, introduce yourself.
Yeah, hi. This is Becca.
Okay, Becca. They're not used to the doctor part yet. All right.
Nope.
You guys, tell us where you are, what you're doing out there in Kansas. Anastasia, you go first.
So we actually just returned this past Friday, and what we did is, well, we didn't know what we would be doing going into this. It was, in my mind, anything in between like critical care situation and some innocent phone call, like contact tracing, and it ended up being something in between. So we helped out with the health department duties. We helped call the patients who were positive. We were working on reporting this data with the CDC. And we also had a chance to work with a wonderful family practice office out there. Becca, do you want to talk a little bit more too?
Yeah, I mean, that pretty well covers it. I would say one of the more unique things that we did was we were able to help a lab in Lenexa that was testing a new test that they're trying to get approved by the FDA. And so we were able to help them with that process by testing known positive patients to give them their positive controls.
All right, good stuff. I'm going to try this again. Koptilova, how's that?
That was spot on.
Man, see, I rehearsed in my head while I was in here a few times. So, well, listen, you guys, we so appreciate what they've been doing, Mike. And anything you want to add?
Yeah, they so with their efforts and the efforts of the others in the group, then we amassed 696 volunteer hours over the time that the graduates have been volunteering. So it's pretty extraordinary. I think, you know, the peak of volunteer help coincided with the peak of need, and we didn't really. I don't know of any need that went unmet. And so I'm very proud of our graduates, and I'm very proud that they stepped up and did some amazing work. And then the respiratory therapists went to work, jumped right in there in the ICUs with ventilator care, and the nursing school and their contact tracing is really where they contributed a great deal.
Yeah,
So,
that's a big deal. Dr.
fabulous stuff.
Koptilova, oh, I didn't say it. Koptilova. Hey, where are you headed now for your residency? What are you doing as you finish this part of your life up?
Yeah, so I will be heading to Chicago to Northwestern Memorial Hospital doing anesthesia.
All right.
Yeah.
Excellent. And Dr. Ferguson, how about you?
I'm going to Henry Ford Hospital out in Detroit for general surgery.
Excellent. Well, just to say, this is a pretty extraordinary thing because most of the time these folks graduate in May. They have to take time off to get ready to move, find a place to live, and start this next really big phase of their lives. To graduate early and to go out and do this, that was a really big step. So, Rebecca or Anastasia, comment a little bit about why did you decide to take this action? Why did you decide to go volunteer like this?
I can start. I know that for me, we had been aware of what was going on in New York and kind of around the world for several weeks at that point. And I was working on finishing up my population health and practice course, which was kind of my last, it was my last graduation requirement. And obviously we were talking about population health and contact tracing and all these different things. And so it really primed me to, one, recognize the need that there was. So I appreciate having that class at a very ideal time. But then also, there's a lot of anticipation for going to residency. And being able to go and kind of dive into this, I think was kind of the blessing in disguise for me as well, because there is a lot to think about and a lot of anticipation and a move and being an intern and being able to work with family practice guys, having been out of the hospital for several months now, was very rejuvenating and made me really excited to get out there and get started.
Well, that's awesome. Anastasia, how about you?
I mean, I definitely second everything Becca said. It was a great opportunity to freshen up the skills that have been maybe rusty for the past few months. And it's hard to say anything else to answer this question because once this opportunity came along, I think there were so many medical students just eager to fill in the spots that if anything, I felt lucky that I had a chance to participate. Just because by some, luck of the situation, I was one of the first to respond and go to the location I wanted to go to. And I can say the same, I'm sure, for the other schools of health professions who were very eager to participate. And thank you to the University of Kansas Medical Center and School of Medicine who put this together for us because none of the friends that I have in medical school across the country had a chance to take part in some sort of an organized program like this.
This is a big deal, Dr. Samari, and just to say a thanks. I think the Med Center and all the schools have done such a great job at helping work in this crisis. And as you mentioned, the work between the system and the university has never been better. Talk to us a little bit about some of the challenges that have been unique, though, to the university and what you're trying to do around education in general.
Right. So, Steve, we're very proud of the students that took this challenge on. If you think about it, two of the most exciting and important days in medical students' career is match day and the hooding. And they had to do both virtually. And in spite of this, and in spite of finishing under these circumstances, these new doctors took on this added responsibility. We're very proud of them. It speaks to the kind of students that we enroll, and it speaks to the leadership and the community of faculty with their commitment to the state. So we thank you for that. Steve, we were actually very lucky from a standpoint of medical education. We've been training students at a distance for over 40 years with a campus in Wichita since the mid-'70s, and then a campus in Salina for the last 10 or 12 years. So when we had to go to a greater dependence upon education at a distance, our faculty and staff were very well trained to do so. I have not been aware of a single concern or complaint about students who were having to take on this new responsibility of learning at a distance. So we were very lucky. But like all educational activities, it was easier to do at the end of the year than it will be to do it at the beginning of the year. And these challenges at the beginning of the year, as we look at summer and fall, are real. We are going to be up to them, but they will be a different set of challenges than finishing with tried and true students who sort of are right at the end of their education. That was a bit of an easier opportunity for us than what's ahead of us. But I think we're up to it. I think our faculty and staff and technologies are up to it. And it's different for us since we don't have a residential part of our education. I think campuses such as Lawrence or other residential campuses have another level of concern, which thankfully we don't have to deal with.
Yeah. A quick story about Rob Samari. So Robin invited me to a town hall back at the beginning of this, and he made the comment. We were both, it was only audio, and he said that Stites, he says, referring to me and to himself, said, yeah, we both have faces made for radio. And so today, as you're coming out, there's only 100,000 people that are seeing us here, man. Watch out.
But thankfully, you have the benefit of makeup, Steve.
All right, what questions do we have out there this morning?
Yes. Dr. Seitz, we've had a person who's kind of persistently been asking about musical theater practice with lots of singing. Is there any opinion you can offer about that?
All right,
Yeah.
Dr. Hawkinson, what are you thinking about musical theater practice? Lots of singing. We know that what happens is we may project a little further those aerosols are not our secretions as we sing.
There's actually a very good infographic right now, I think up on the CDC website for morbidity and mortality report. If you Google, I think just morbidity and mortality report, weekly report, I think right when it comes up, there's a very good infographic actually detailing about an infection cluster caused by choir practice. So it shows up in the top left-hand corner where the index patient was, and everybody that was infected in the cluster after that during the choir practice. So I think right now, at this date, it's still probably pretty dangerous. I don't know all of the details of that choir practice, and hopefully the industry will be putting out some guidance for that. But we know that that happens and that occurs, and there's very good documentation of infections and clusters from that. So I think moving forward with kid gloves on and slowly to do that and methodically is going to be the way to go. But right now I think it's really still very dangerous.
I think it's all about risk tolerance, right? And the problem is that you give your risk to others when you're in a situation like that, and then you inherit everybody else's risk in that room and everybody they could have been with, and remembering that coronavirus can be asymptomatic for up to 2 to 5 days prior to you manifesting symptoms, and young people may manifest pretty minimal symptoms. So you just have to be really thoughtful about that. Jill, you had another question this case.
Yeah, we have about 20 here, but I wanted to let media, I know that we have several on the line. So
Please.
specifically media, do you have any questions? We'll let you go first. Going once?
Not hearing
Twice.
any. What do you got, Jill?
All right. I have lots. So let's talk about face masks. Is it okay to leave my face mask in the sun on the dash of the car in between uses?
What do you think, Dana? Because that's one of my strategies is to try and keep it. No, I'm not joking. I'm serious. I put it out there. It stays in the sun. It warms up. And after about a day or 2 days, how long does it need?
Yeah, I think that's an okay practice. Again, you want to make sure, especially if it's the cloth mask, that you are cleaning it. We've always said maybe you want to have 3 or 4 of the cloth masks so that you can use them in rotation where you're cleaning one, where you're using one and then one in storage. Certainly, I think leaving it in the car for a while would be okay on the dash. Maybe there is some effect of the UV rays from the sun. We know that ultraviolet rays from the sun can have harmful effects on our skin, causing skin cancer, but against other microorganisms as well. I think that's an okay thing to do, but also keep in mind, again, maybe you want 2 or 3 masks so that you can be cleaning one, using one, and have one in storage for use.
Mike, were you out at all this weekend? Did you get around some?
Oh, yeah.
What'd you find? What'd you see out there?
No, actually, we went just walking. And on the walking path, there are just so many people. It's pretty ridiculous.
Social distancing, mask on, mask off.
So no masks. And so we were walking in the grass the whole time rather than walking on the sidewalk because people were just crowding the sidewalk.
That's where
It's like there's no care in the world.
Rebecca and Anastasia, you all are young. What are you seeing out there? Are you going out?
I have certainly not been going out. And whenever I do have to make an outing, it's always a mask on for me.
You have learned well.
Yeah,
Those courses did a good job.
Yeah, I was
Excellent.
going to say the same thing. I have a couple of masks in my car that stay in there, and there I try to minimize, even just like used to go to the grocery store with my mom because I got time, but it's unnecessary for me to go to the grocery store or to have two people there. So just trying to minimize number of people going out since I do live in a household. I have 3 brothers, any of which are up for grabs if anybody is lonely. I can come and quarantine with
We'll see
them.
what our audience says here. Going once. Go ahead. Sorry.
No, that's it. I think we've done a pretty good job of trying to minimize exposure. And yeah, masks are essential for sure.
It's interesting because we try to do the same thing. Anytime I get out of the car, man, my mask is on. I go to the grocery store, mask is on. And I think people have been lulled a little into a false sense of security because we did bend the curve in Kansas City. And as a result, and somewhat in the Midwest, and I think population density has a lot to do with it, Dana, but we have to be observant. How long before we know if all this going out is going to really impact us, do you think?
Yeah, I think based on Saturday, I feel that our best time points of data and projection will probably be in 10 to 14 days from now, as far as when, now we have better testing capacity. We have more places out doing it, out available to get tests. We will then understand who is becoming symptomatic, who will need hospitalization. So I think 10 to 14 days from now is really going to be a better judge of where we were at and how we are going to be progressing and what the velocity of the changes and the number of infections is going to be.
So June 1st is going to tell us a lot.
I think we'll have a lot better information.
I do too.
Mask wearing is really important, and so there's a couple of more questions on masks, and then we'll move on to another topic. But I'm going to combine these two. If I'm running errands, is it okay to take my mask off in between?
Yeah.
Can I use just that same mask all day long? And then the person also wants to know, with a cloth mask, why is it a one-way street? And what they're saying is...
Yeah, we got it. So Dana, go.
You want me or Dr.
No.
Kennedy?
No, I'm going to turn to Kennedy in a minute. I'm going to have time to turn to Samari in just a minute. Watch this.
Okay. Do you want me to? Okay.
Yeah.
So there's a lot of questions in there. The first one was, is it a one-way street? Well, certainly significantly cut down on the chance of getting infected, especially if you need to be in 6 feet or closer. Again, continue to maintain your 6, 8, 10 feet distance if you can.
Yeah, I think that's really critical. And people have to understand is the cloth masks, the fibers are separated by a certain distance, and that's what allows university approaching that.
Well, but to be quite honest, Steve, what we do is keep very close contact with the health system to understand what the health system is doing. But currently, we're going to be wearing cloth masks in and then getting provided a surgical mask for use for that day with extras for soiling. But we have not yet found a provider of cloth masks that we think are the equivalent of a surgical mask that might be reusable and more affordable than surgical masks. We're still trying to locate those. And in the meantime, we're going to be providing our folks surgical masks for use, all but when they're by themselves in a closed office.
Yeah, and I think that's right. And the masks the supply chain has come back. N95s are still difficult, but the surgical masks have gotten better, Dana.
Yeah, and we've shown from healthcare workers wearing the surgical mask is protection as well as appropriate eye protection. But I like to say, as the supply chain comes back, and maybe there are legitimate pharmacies who are going to be getting in surgical grade masks, it's probably not a bad idea if you do want to get those, as long as we have the supplies for that. The other question was, can I take my mask off in between? So we've always endorsed, not manipulating and touching the mask. And as we get into the hotter summer months, it's going to be more difficult to keep the mask on. But certainly, if you can be running errands and keep the mask on without manipulating it, that's probably going to be better. If you do have to remove it getting into the car or getting in and out from the errands, it's probably best to always keep some hand gel or alcohol hand spray in your car and do the hand hygiene prior to removing and then prior to replacing the mask.
And Dana, we don't have masks on here in this presentation, in this program. Talk to us a little bit about that. We debate this every morning.
We do, and it's very important. We want to keep our message consistent. We have addressed this. We come in with the mask on. We take the mask off probably, 30 seconds before we start. We are separated by distance. We do frequent hand hygiene. Once the show is over and we go to clear, we put it right back on and move about our day.
part of the struggle is trying to understand us with a mic on and a
Yes.
mask on. It's a little bit of a challenge to that. What do you teach our students, Dr. Kennedy?
So we actually, before the volunteers went out, they got all the training on, of course, it's all virtual, right? So, but they're required to view the videos on proper donning and doffing.
Come, Dana.
Not just yet. Our health system continues to evaluate. I think we are pretty close about deciding on an antibody test or one or two different from different companies to use. The antibody tests are becoming more accurate. Now it should be about the time when some of these companies should be submitting their data about detecting the antibodies, again, to make sure that the sensitivity and specificity and the ability to predict that you've had it because of the result.
Tested because of the nature of this pandemic and the large healthcare crisis. Now that we've had time to do it, that these companies that have had those testing kits are having to submit the information into the FDA, and they're going to be evaluated for whether or not they can stay on the market. So it's been a little bit of a thing. You had to really try to figure out if that antibody testing, and we were never satisfied that they were actually accurate here.
Right.
I think we are now. There's a couple of them out there we think are better, and we have sent some patients. Mayo has a reference lab we've used some.
And even for that, we have to make sure, just as with the PCR tests, that we can get the kits in from the company so that we can actually do the test.
And
as
that's our
well.
routine
So
test.
another-
And a college student, one of them's been invited to the lake. She knows she can't go anywhere. Is it okay if she lets her kids go?
Oh, that's a hard one. What do you think, Dana? I know what my answer would be.
I think this is kind of consistent with what we've been talking about. Who is in your bubble and what is the level of risk? So certainly to the lake, and can easily spread this disease. And so that's the real difficult question to ask is, who is in your bubble? What is the level of risk?
And here's what I would say. If you're an active cancer patient, it's not safe. And that teenager, if they decide to go, has to be quarantined when they get back for 2 weeks. And when I mean quarantine, I mean hardcore quarantine, because we know that active cancer patients are the ones that are one of the highest risk populations. And so when I mean real quarantine, I mean that you're in your room, you're not coming out, you don't eat with anybody, and we'll put your food at the door. I mean, if you have active cancer, I think that's an even different consideration than, say, I'm a recovered cancer patient. Okay, that's a different story. But active cancer in treatment, that's a big risk. And I think that it just is what it is, and it's a short-term sacrifice, and hopefully in the long run, that person will get healthy with their cancer, and all their family will stay healthy as well. So I'd be hard-pressed to think that's a safe environment to let someone go.
Hairdressers, several on the line this morning that say they're not getting a lot of good advice from their professional organizations, and they would like some from you.
Oh boy, hairdressers. Okay, here's my confession. This is what I did this weekend. I went to Birch to cut my hair. Now, a few years ago, that person cut my price in half because I don't have as much hair as I used to. She's like, I can't charge a full price anymore. But I talked with them before, and here's what they're doing. They're wiping everything down. They wear masks. Every cape that you put over is new. I had a mask on. She had a face shield on. So to me, that's the same thing as going to the clinic. Those are very similar to the clinic precautions that we use, Dana. So I said, okay, it only takes about 10 to 15 minutes to cut my hair. So I thought, I'm okay to go in and come out. What do you think, though?
Yeah, I agree. I think there are things that the hairstylist can do, and there are things that the client can do. Certainly both having masks. Each person making sure that they're doing hand hygiene right before either coming into the shop or right before working on the client. If you can use new capes or gowns for every client, that's good. Get them washed and cleaned, and then after you're done, making sure that prior to leaving the stylist, you're using the hand hygiene, getting into your car using hand hygiene. Don't manipulate the mask while at the stylist's either home or shop. And I think those things you can do and really decrease the amount and risk. But again, if either the stylist or the client is having symptoms or ill, then don't go and don't be doing that. But those are things that you can do to reduce the risk.
And they actually asked to see if I had any COVID symptoms the day before. So I think those are the right things, really. And it sounds hard, but I think it's true. You have to try and find out if your stylist is sick, you've been sick. Both of you wearing masks. The stylist should wear a face shield, and then you should have a cape that's changed between patients, and using alcohol wipes between everything, and then the equipment can't be the same. And the scissors have to be cleaned. Everything has to be wiped down in between folks. So I think those are the things that can make it a safer environment. And fortunately, I was in that position, so I think that was good. Dr. Samari, have you gotten a haircut?
I've very lucky that during my residency days, my wife learned how to cut my hair. So I think she deserves a lot of credit for what I'm
Pretty good. I think it looks good. I like it. I like it. And Dr. Kennedy, how about you?
My wife cuts my hair.
Yeah, my wife did mine at first, and then she kind of swore off of it, I think. So, Dana, you're younger. Right?
I need to get one. I clipped my own front a couple weeks ago, but
Yeah.
soon I will be going.
I thought that's what happened to you. It looked a little sketchy up there.
It's hard to
top,
do in
brother.
the mirror, let me tell you, but oh well.
Anastasia and Rebecca, what are you doing for haircuts? Or I guess really, because you're not a guy, you may not call it a haircut, but
Oh,
I
it is
guess
a
we're
trial.
growing the hair out in the meantime.
okay. Anastasia, you go first.
Oh, I said I guess we're just growing the hair out in the meantime.
All right, Rebecca.
Yeah, I can go a long time without getting my hair cut, but I'm getting a little desperate. I'm actually, now that you guys brought it up, I just texted my mom and asked if her hairdresser is taking appointments.
And if it's long enough, you can donate to Locks of Love.
There you go. All
Double.
sorts of good things
Silver lining of COVID.
that you can do. So, Anastasia, Rebecca, when you all went out this weekend, Rebecca, we'll start with you. If you've been out at all this last weekend and things, or around, did you see people wearing masks, not wearing masks?
A lot of not wearing masks, unfortunately, which is very disappointing. I certainly have my mask on. You know, anytime I'm going in and out of someplace, I've got hand sanitizer sitting in the cup holder in my car because I do take mine on and off when I'm driving. But like I was out yesterday, had a socially distanced gathering on the Nelson Atkins lawn, and there are a lot of people there, but you can tell that they're trying to social distance, but it just seems like it was just shocking how many people were out there. So I didn't stay for very long at all.
Yeah, it is. Boy, it's like that. And Anastasia, how about you?
I see the same thing pretty much. A lot of people, unfortunately, don't wear them still. But I do catch myself leaving a car or my house without one every once in a while because I just still don't have that strong habit. But then I catch myself, I go back, I put it back on. I think it just takes time to develop that kind of habit.
Yeah, well spoken, both of you. Thank you all very much. And by the way, what was it like to graduate virtually? Rebecca, how was that?
It was funny when we went out to Dodge because it was, technically 2 weeks before our actual virtual graduation. And so I went out there, and one of my first patients was like, oh, are you a doctor? I was like, well, actually, I recently graduated. And they were like, well, when? And I said, well, I guess sometime over the weekend. But now that we had the virtual graduation, it was actually really special. And I've seen a lot of really special posts from friends on social media who were able to keep people within their circle who were already there. A lot of us are living, with parents or near parents, getting ready to move. And for example, my grandmother is a PhD, and so she was able to hood me. She had her regalia. I borrowed regalia from someone else. And it ended up being a really special, really meaningful moment. And I think a lot of us were able to make that, and we really appreciate all of the school's efforts to create that meaningful moment as well. And just so appreciative of what the school has done to continue to support us through these last couple weeks.
That's awesome. And Anastasia, how about with you?
Yeah, so the whole thing took place virtually pretty much. I was hooded virtually. I gave my oath to the Hippocrates virtually. The whole thing, it did not feel exactly like what I always envisioned, but I think it still felt like a celebration. I got to take pictures in my gown and the hood and all of that regalia. So yeah, it was good. It was meaningful. Yeah.
Dana, you had a comment.
Yeah, I would like to say, to echo Dr. Samari's comments and our young doctor's comments, in addition to those 2 dates that he mentioned, the other date is walking down the hill at KU, and it's an extremely important date. I was able to do it as a physician. It was a great time. I was talking with a friend this weekend. It took her a few years, but she got down the hill, and it was one of the best days of her life. It's just a great experience, and it's unfortunate that the young doctors and all the graduates were not able to do that this year.
Any plans in the long run, Dr. Samari, to address that lack of a hill walk? Because that is a big tradition for the University of Kansas.
Yeah, so I'd first like to say that it is rather ironic that the class of 1970 that was canceled because of the Union burning down had agreed to come to walk down the hill on their 50th anniversary, 2020. So they are 0 for 2 in being able to walk down. However, this was a commemoration of graduation and not graduation. The Chancellor is holding out hope that when the time is right, whether that be the summer, fall, winter, or next spring, there will be a hill walk that will be identified for the class of 2020. So there will still be a graduation. It's just not been determined when it will be.
Yeah, that's a big deal. And hopefully, as we talked with Dr. Moran, Senator Moran, about on Friday with Dr. Collins' announcement at a board meeting. Yeah. Samari's making fun of me for calling Dr. Moran at our board meeting, that we may actually see vaccination even as early as this fall. And when Francis Collins says something like that, that's a big deal. If that starts coming out in October, November, and December, that could be a pretty big game changer. We probably have time for one more question. And let's see. Anything from the media? Not hearing anything. Jill, anything else?
How long do people who are asymptomatic likely to carry or spread the virus? Do we know?
We hit that for a few minutes earlier today.
Yeah,
Dana?
so that's an interesting question. You know, I think we're seeing a little bit different experience now as we're getting to having more people in the United States infected, more people in Kansas infected. We are seeing a lot of those clusters of workplaces that have been infected, and it's really unclear, you know, are these people really asymptomatic? Are they having mild illness? So it's really hard to say, you know, how long are you first of all asymptomatic? So you can spread the virus probably for at least, you know, like we had said, 1 to 2 to 5 days prior to having symptoms, to anywhere from probably a week to 10 days. We don't have a lot of good information. How long can you spread the virus? Our best information comes from some small studies looking at viral culture, and at least in the upper respiratory tract, they weren't able to actually culture virus for the most part after about 10 days. So we're probably going to say 1 to 2 to 4 to 5 days prior to any symptoms, prior to at least 10 days after symptoms start. And that's probably about the best estimate. That's a pretty broad range, but that's probably the best estimate we have right now.
All right. Well, as we wind up today's show, or today's program, I'd like to just talk to Dr. Cannon. Any final thoughts this morning?
Well, I just want to express my extreme gratitude to the early graduates who wanted to volunteer. I'm glad we could put a program together that met all of our needs. And then I gotta say thank you to the Patterson Family Foundation for contributing significant funding to help put this program together as well.
Yeah, that's a big deal. Dr. Samari, final thoughts?
Can I ask Dr. Hutchinson a question?
Please.
So a county like Saline County has had scores of cases, and they get a case every 3 or 4.
Don't want to seek medical care. They're concerned about, you know, especially if they're illegal. So it's really difficult to say about if people are, you know, is there a testing issue as well? Are you able to get out to the broad people to be able to test? Or even if they are symptomatic, are they seeking medical care? So I think there are a lot of issues there. Certainly what we know is we haven't seen a lot of hospitalizations throughout the state for these big clusters of infections, which is really a great thing. And I think we need to continue to investigate that and the whys of that.
So I don't have great answers, but tomorrow we will have some folks on our program that may help with some of that. Lee Norman returns, the Secretary of the Kansas Department of Health and Education, along with Ed Ellerbach, the Chair of the Department of Population Health, and David Wild, VP of Performance Improvement here at the health system. We're going to talk about modeling and kind of explore some of the questions like Dr. Samari just raised. And what are these socioeconomic factors? The population density, is it because some people, especially in a densely populated area like New York, are getting such a large amount of exposure that it overwhelms our own host response system? What is it that's creating this difference in outcomes? And why were some areas in New York City affected a lot more than other areas of New York City? So there's a lot of questions that will probably take several careers. The university has just done great work throughout this whole time. And Dr. Samari highlighted a while ago that some of our best faculty are out there working with these county health departments many of them out of our Department of Family Medicine, who continues their tradition of strong social justice and social work, and Dr. Kennedy is a part of that department. To everyone out there, we'll be back here tomorrow. Thank you so much for listening, and we'll hear about what the new thoughts are around modeling as we anxiously await June 1st to see, are we going to avoid the next surge? We'll talk to you tomorrow.